So hi everyone. First, my name is Mauricio Molinari Ulate. I am a technical officer at Cluster CV. Our entity is Cluster CV. I think it's a different ecosystem from most of the ones that are already here, because we are not in the field of biotech, and that's the particular characteristic that we have. So Cluster CV was created in 2013. And we mainly focus on the region of Castilla y León in Spain, but we are also a national cluster. And we are a national cluster because we are basically the only cluster in the health sector that is oriented mainly to the social services. We try to cover social and healthcare, but we mainly focus on social care, specifically for the populations of people living with disabilities, and mainly on older adults, so aging. So CV basically works to make available new and better services for the social care sector by a digital transformation that include several technologies, including AI, VR, AR, digital health in general, sensoring and monitoring devices, so that we can complement and facilitate the professional care. The cluster is made up around 66 entities, actually, and it covers the entire value of change of the chain of the ecosystem. We have civil society entities, technology and research centers, private companies, a public administration. And I think what it works very well in the ecosystem is the public and private sector commitment and the collaboration between both, especially from the regional government in Castilla y León, which is very supportive in the ecosystem. Our main fields are independent living, active and healthy aging, demographic change, silver economy, and mental health. So our main priorities or main actions are technological vigilance, research and development. And now we are starting on a living lab, mainly because we want to include the target population on the co-creation of the whole process of the technologies that are being developed by our members. So we offer consultancy and technological developments for external projects that are being funded by national and European resources, marketing, technology transfer, and also with the Living Lab, as I said, we want to get deeper into research and innovation, but mainly on involving experts by experience in the whole development of these technologies, that I think it's crucial to do more friendly devices and friendly technologies. So this is our ecosystem. Since the cluster started, it usually work with a quadruple helix ecosystem, but as you can see, we want to evolve to a quintuple helix ecosystem, that it includes public entities, representatives of civil society and service providers, industry, academia and research centers. But then we want to involve the whole ecosystem, as we are moving into a new era, I think, in terms of the environment and more sustainability, involving the whole ecosystem. And we want to do that through our most recent project, that is the Technology Innovation Hub, that is going to be located in Zamora, which is a very small city in Spain, in the border with Portugal, just above Salamanca. If you know Salamanca, just going a bit north. And we want to do this in this city because of one of the main problematics of the region, that is the rural areas are aging a lot, and there's less social care and healthcare services. So we want to try to solve this through the digital transformation. And as part of the hub, we are also developing a living lab. So this is our three main projects at the moment. As you can see, Revital, it's the project, it aims to offer rehabilitation services to these rural areas through teleassistance and telerehabilitation. We're working this with partners in France and Portugal. Then I also mentioned the last meeting, the MedicNest meta cluster.
Yeah.
So I think this is very important. If you want to know more about MedicNest meta cluster, you can just Google it. The meta cluster, basically, it's dedicated to digital precision medicine. And I think several of the clusters that were the main partners, which are Imago Mall from Romania, Medvia from Belgium, and the Hellenic cluster in Greece, are also in the ECH Alliance ecosystem. And well, I already mentioned the Hub and the Living Lab. These are our networks. We are also part of the reference site of healthy aging. Also, we are part of ECH Alliance as well. And what Idoia mentioned, which I think it's a pretty nice initiative, is the health clusters in Spain are joining together. So that's I think that's going to be a very powerful tool. And we are in our 10th anniversary, and I'm gonna pass the word to my colleague Melania Dabrowska, that she's gonna invite you to the event that we have for this 10th anniversary.